We've had a bill that we have seen for 2 hours. 2 hours. It affects the health care, perhaps the lives, almost certainly the lives of millions. It affects the lives, the daily lives of men and women and children. And we haven't even had a chance to explore all the ramifications. There's a lot of anger on the other side at the ACA. I understand that. But you're repeating what you claim are the same mistakes. And just as maybe Obamacare could have been made better if it were a bipartisan proposal, this one certainly would have been made better. Certainly would have been made better. This skinny repeal, CBO tells us, will kick 15 million people, 16 million people off care. This skinny bill, after all the cries of reducing premiums as the major reason that Obamacare needed changes, will raise premiums 20% a year ad infinitum. The average working family is going to struggle to get health care, even more than they have now. And why is this being rushed through this way? Why is this being done in the dark of night? I can't believe my colleagues are proud of it. If they were, there'd be brass bands down the streets of small-town America celebrating this bill. That's not what's happening. It's midnight. Debate is curtailed. We can't amend it in broad open. We can't do what's needed. So I would plead once more with my colleagues. Let's start over. We are the first to admit that the present law needs some changes. We are the first to want, maybe having learned our own lessons, that it should be done in a bipartisan and sharing way. Let's start over. We can do better. We can do better for all those people who are going to be hurt.